for allocation in the federal Tiberius system that allocates vaccines to the states. This was certainly shocking for our teams, as just a few days earlier, we, like the rest of the country, heard HHS Secretary Azar's announcement that the federal government was releasing the entire federal supply to help the states expedite vaccinations. As a result, we quickly began adjusting our distribution plans to accommodate the increased shipments of vaccines that were promised to arrive from the national stockpile next week. Then last night, Director Allen and I called General Perna of Operation Warp Speed to track down some more information. That's when he confirmed directly to us that states would not be receiving any increased shipments of vaccines. Despite clear statements just a couple of days earlier, he said there were actually no extra vaccines sitting on their shelves. Let me be very clear. This is deception on a national scale. The arrival of the first COVID-19 vaccines in Oregon last month brought much needed excitement and hope for all of us. Hope for our economies, hope for our communities that have borne such hardships from the pandemic. We all long for better days ahead. And with each vaccination, we are certainly one step closer to that goal. I am shocked and appalled that the federal government would set an expectation with the American people on which they knew they could not deliver with such grave consequences. Upon hearing the news of increased vaccines coming our way, we immediately adjusted our plans to open up vaccination eligibility to Oregonians over 65. I'm certainly demanding answers from the Trump administration. Their empty promises are literally playing with people's lives. So many of Oregon's seniors have spent the past year separated from their children and their grandchildren, and certainly we're eager to hear that additional life-saving vaccines were headed to the states for them. Here's what I will say. While the Trump administration pulled the rug out from under us like a cruel joke, let me assure you that Oregon's priorities and my priorities have not changed. I remain committed to vaccinating our seniors quickly, but this failure by the Trump administration will unfortunately cause a 2-week delay in beginning vaccinations for seniors. Additionally, being supplied less vaccine than promised forces some difficult choices. Beginning on February 8th, we will start vaccinating our most vulnerable seniors, those age 80 years and older. Our experience shows that this group has among the highest mortality rates. And as we're adjusting to this news, we must return to the schedule and prioritization we had put in place before this week's empty promises. The good news is that we have significantly increased the number of vaccinations delivered per day. As I've said for months, one of my main priorities is getting our kids back to in-person instruction in the classroom and to protect our educational staff to help achieve this goal. Starting the week of January 25th, we will begin vaccinations of our educators and school staff. And in some counties, this may start even sooner. Today's press conference was intended to be an opportunity for us to lay out the plan in which we were going to embrace the surge of vaccine doses headed our way and vaccinate more Oregonians. While we know now that a surge is not coming, we would still like to share our Oregon plan with you. Last week, I directed the Oregon Health Authority to speed up our efforts and reach the benchmark of 12,000 vaccinations administered each day. I gave them 2 weeks to achieve that goal, and the Oregon Health Authority has delivered. On January 8th, we hit that 12,000 mark. Today, Oregon added more than 26 vaccines administered to our registry. OHA has been working with healthcare providers, hospitals, pharmacies, local public health partners, and our National Guard to streamline the distribution process and vaccinate Oregonians more quickly. Across the state, we continue to vaccinate Oregon's frontline healthcare workers, individuals with intellectual and developmental disabilities and their caregivers, long-term care residents and staff, and more. Everyone is stepping up, and as a result, we're making really good progress. I'm pleased to see that so many Oregonians are eager to get these safe and effective vaccines. Thank you, OHA. Thank you to our National Guard, and thank you to our healthcare community for working at lightning speed to vaccinate Oregonians. But this is just the beginning. We will remain laser focused as we prepare to continue to scale up our efforts. Soon, we will have a strong, competent, and trustworthy partner we can work with at the federal level. Just yesterday, the Biden-Harris administration announced a much-needed $1.9 trillion coronavirus relief package. I very much look forward to working with them and with Congress on getting this groundbreaking, much-needed package across the finish line. And with that, I'm going to turn it over to Director Allen and General Stencil to go into more details about our plan. Over to you, Director Allen.
Thank you, Governor Brown. This afternoon, I want to give you an update on how we ramped up to reach Governor Brown's target of 12,000 vaccinations and our plans to sustain that effort as we move forward. The actions we announced last week have begun to pay off, and we passed 12,000 doses administered in a day on Friday, January 8th. We've administered over 12,000 doses each of Tuesday and Wednesday, and expect Thursday to total over 12,000 when all reports are in. I also want to tell you how we plan to offer vaccinations to educators and people over 65, despite our disappointment that the federal government has told us they cannot deliver on the doses they've promised Oregon. We've seen how chaotic the expansion of vaccinations has been to seniors in other states. We're taking steps to anticipate and mitigate similar challenges here, though it's a very large population, and I anticipate it will still be a difficult rollout. We're going to take a different approach that stays true to our strategy to prioritize the hardest hit and most at risk based on data. But the approach we take completely depends on Oregon getting a reliable supply of doses from the federal government. In addition, I want to share some new tools Oregonians can use to learn when they can expect to be vaccinated and where they can go to get immunized. I'll also tell you how many doses we currently expect from the federal government and how we intend to allocate them in coming weeks and months to finish vaccinating healthcare workers and people in long-term care facilities, along with educators and seniors. And please this, I want to underscore the importance of keeping our commitment to priority communities in Phase 1A, especially people with intellectual and developmental disabilities. First, I want to echo Governor Brown's disappointment that the federal government is not actually able to provide the additional doses Secretary Azar pledged earlier this week. In Oregon, we had expected to receive about 200,000 doses, which would have sped the vaccinations of educators and seniors. I wrote Secretary Azar last night to tell him how troubled I am by this development and to ask Health and Human Services to clarify the situation. So far, I haven't received a response. While I'm deeply disappointed to learn the federal government apparently does not actually have the reserve Secretary Azar promised, we intend to fulfill our commitment to educators and seniors. However, we will need to adjust our timelines. More on that in a minute. Now, let me give you an update on our latest numbers. Today, Oregon added a total of 26,936 additional COVID-19 vaccinations to the state's vaccine registry. Of that total, 10,618 first and second doses were reported administered yesterday, and that total will grow as additional vaccinations that occurred on January 14th are reported to the registry. Oregon vaccination sites in total have administered 173,073 first and second doses of COVID-19 vaccines. Based on today's report, Oregon ranks tied for 24th in the nation in vaccines administered at 39%. The national average is 36%. We're ahead of all our surrounding neighbors in Washington, California, Idaho, and Nevada. We're 30th in the nation in the percent of our population vaccinated at 2.8%, Based on this metric, we're also ahead of all of our surrounding neighbors. I know we all want vaccinations to go faster in Oregon, despite the fact that these data show we're in line with most states and ahead of our neighbors. I want vaccinations to go faster too. At the Oregon Health Authority, just like the federal government and health agencies in nearly every other state, we needed to have been better prepared. We should have recognized that our well-tested and high-performing system for distributing flu vaccines would not translate to the demands of distributing the COVID-19 vaccines. We should have anticipated the unique challenges these new vaccines posed. For example, we needed a better hub system to distribute the vaccines with their ultra-cold storage requirements and time-limited handling demands. We should have anticipated the challenges we'd face in vaccinating the wide range of groups in Phase 1A. We needed to recognize we'd have to work with many sites that had little experience organizing vaccinations. We needed to better provide better training to partners. They needed to know more about what to expect when vaccines arrived so they could more quickly organize their rollouts. They needed to better understand how to log their data so Oregon's numbers weren't artificially depressed by slow data entry, and we could make more informed allocation decisions. But we've adjusted. The reality is that, like the virus itself, the COVID-19 vaccines have presented us with unprecedented difficulties. But in the same way Oregonians are making changes in their lives to keep each other safe, our healthcare and public health systems are adapting to administer vaccines faster and to more people. In the space of a month, we're building new systems for administering vaccines and connecting people to vaccination sites. And Oregon isn't alone. As we climb the state rankings in the pace of distributing the vaccines, it becomes clearer and clearer that other states are struggling in similar ways. But here, the changes we announced last week to speed up the pace of Oregon's COVID-19 vaccination effort has paid off, especially our decisions to simplify the prioritization rules for Phase 1A groups and adjust the supply allocation process to get more doses in hands of vaccinators at sites with the capacity to serve large numbers of people each day. As a result, the number of doses administered per day over the past week more than doubled, and we met Governor Brown's goal to deliver 12,000 doses per day. For example, on Monday, January 4th, when the governor announced her target, Oregon vaccination sites administered 5,142 doses. On Friday, January 8th, after we simplified the prioritization process for people in Phase 1A and delivered more doses to high throughput locations such as Salem Health's clinic at the state fairgrounds, sites administered a total of 12,283 doses. On Tuesday, January 12th, Oregon vaccination sites administered 12,171 doses. On Wednesday, the 13th, sites administered 13,100 doses. All these numbers are as of reports received through midnight last night. But let's be clear, the state can't achieve our goal to deliver vaccinations quickly, efficiently, and equitably all on its own. I'm grateful for the hard work that nurses, schedulers, data analysts, and so many other staff in hospitals, local health clinics, tribal health centers, and other sites have put into ramping up vaccinations for Oregon. Where does that leave us? As of today, Oregon's vaccinated close to 40% of the Phase 1A population. By January 25th, we expect to have vaccinated approximately 56% of the people in Phase 1A groups, or 225,000 healthcare workers, first responders, and staff and residents in long-term care facilities, if vaccinations continue at our current rate. By the 30th, we expect to have vaccinated approximately 300,000 people in Phase 1A groups, or 3/4 of people eligible. Now that the actions we've taken have quickened the pace of vaccinations, what's our plan to build on this progress? Between now and January 25th, we'll continue to improve data reporting with ongoing support to local vaccination sites so our data more accurately reflects actual vaccination administration on the ground, and we have more reliable information we can use to make allocation decisions. Second, we'll encourage sites to quickly draw down the remaining inventory of doses on hand. We know sites are catching up on their data. We also know many doses have the name of a healthcare worker, a first responder, or another worker in a Phase 1A group on them, but haven't been administered yet due to a range of logistical complexities and simple scheduling issues. We need sites to complete these vaccinations to the full extent possible to lessen the chance of bottlenecks before we move on. Third, we need to prioritize our allocation of vaccine doses to high volume, high throughput sites. Salem Health's vaccine clinic at the state fairgrounds demonstrated how efficiently high capacity vaccination clinics can immunize large numbers of people. In coming weeks, we're coordinating with hospitals and local public health partners to drive doses to similar large scale vaccination clinics throughout the state and you'll hear a little bit more about that from Trent Green from Legacy in a moment. And fourth, expand vaccinations to people at highest risk in phase 1A. As we announced last week, we will leverage our partnerships to bring mobile vaccination clinics to homes serving people with intellectual and developmental disabilities, adult foster homes, behavioral health programs, and other group settings that serve vulnerable people. These steps will establish a solid foundation that will enable us to move into the next phase, vaccinating educators as early as January 25th if federal supplies come through. I want to be clear. Oregon had a 12-week plan to vaccinate seniors and educators, but our plan was entirely contingent on receiving the doses of COVID-19 the federal government had promised states. On Tuesday, Secretary Azar pledged to send states, quote, the full reserve of doses available that have been held in physical reserve. If Oregon does not receive those doses, our timeline for quickly vaccinating educators and seniors is in jeopardy because states like Oregon have not been provided adequate supplies of vaccine from the federal government. We must have that surge supply that federal officials promised to move forward and immunize educators and seniors from COVID-19. If we receive the promised doses, here's how we would plan to protect educators and seniors. In Oregon, we estimate there are approximately 100,000 educators and other staff who work in childcare, early learning, and K-12 schools. Nearly 800,000 Oregonians are 65 and older. Until we received yesterday's news, Oregon estimated we would get between 135,000 and 225,000 Pfizer and Moderna second doses released from the federal supply. That increased allocation would have increased Oregon's supply from an expected 154,000 doses we knew we'd get next week to approximately 282,000 doses or more in total. With that surge supply and our expected regular allotment of doses in coming weeks, we plan to stage a phased rollout of vaccinations for seniors. Once again, we need to adjust. We know we have far more educators and seniors than we have doses per week. We know that many seniors have been frustrated in other states that have expanded vaccinations to older adults. Here's how we plan to move forward. We will open vaccinations to educators starting January 25th, recognizing that a handful of counties have plans to begin tiptoeing into vaccinating their teachers this week, depending on their supply of vaccine on hand. We hope to vaccinate most educators within 2 weeks, but as always, that entirely depends on the doses we receive from the federal government. Here's how we plan to take an evidence-based approach to vaccinating Oregon seniors. It's consistent with our principle of prioritizing people who are hardest hit and most at risk. We propose to vaccinate seniors in 4 waves if supplies allow. Wave 1 is seniors who are 80 and older. This population represents approximately 30% of COVID-19 deaths in Oregon. This initial wave will be eligible for vaccination starting February 8th. Wave 2 is seniors who are 75 and over, and that wave will follow. Wave 3, seniors who are 70 and over would follow next, and Wave 4 would expand eligibility to all Oregonians 65 and above in the weeks after. While we want to vaccinate seniors as soon as we can, our ability to immunize this vulnerable population depends on getting enough doses from the federal government. We must have the supplies we've been promised. In the meantime, we will do everything we can to make vaccinations easier to get for everyone who's eligible. We'll continue to encourage everyone eligible in phase 1A to get a vaccination as we open vaccinations to educators and seniors. We continue to prioritize our vaccination allocations to high throughput vaccination sites. I appreciate the efforts of hospitals and other partners to organize these efforts. Right now, we have more interest than we have vaccines available. However, all the organizational work underway will help widen the pipeline as we receive additional vaccine supplies. We'll continue to pursue retail pharmacy options for everyone who's eligible for vaccinations. In February, we asked to be included in a federal pharmacy program that will enable eligible Oregonians to go to certain retail pharmacies to obtain a COVID-19 vaccination. These allocations are in addition to Oregon's state allocation. In addition, we'll continue to pursue state-level partnerships to expand the universe of retail pharmacy options for Oregonians. In addition, it's not just important to give people more options to get vaccinated. We want to tell them where, when, and how they can get immunized. Today on our website, covidvaccine.oregon.gov, people will find a new personalized interactive guide that tells you if you're eligible to get a vaccine based on your age and occupation, where you can get a vaccine based on your local county resources, where you can get the facts about vaccines and answers to your vaccination questions. Next week, Oregonians will also be able to call and talk to someone who can answer their questions about eligibility and get directed to local resources. We will have this call center available in coming days before we expand vaccination eligibility to teachers. As we go forward, we'll share information about other tools Oregonians can use to stay informed and receive alerts about their eligibility for a vaccine and where they can go to get immunized. Finally, while there's been a lot of confusion, I want to make this additional point clear. We continue to manage our stocks to ensure that people who receive a first dose have their second dose set aside for them. People should keep that fact in mind when they look at the doses on hand and at vaccination sites. As an example, we're going to receive over 70,000 Moderna second doses next week, and those are for people whose eligibility for a booster dose will occur over the next 3 to 4 weeks. If the guidance we receive from CDC changes, we will let Oregonians know, but so far they continue to recommend 2 doses. Doctors and medical scientists tell us a vaccine is the safest and most effective way to stop the spread of the virus. Once people get vaccinated, we will be free to see our loved ones, celebrate holidays together, get back to normal life. We'll also be free to open businesses and schools again. I want to encourage everyone who's eligible to get immunized. And if you're not eligible, stay informed, get the facts, and get ready. We're doing everything we can to get you vaccinated as soon as we can, as long as we get the vaccines we need to protect Oregonians. In the meantime, keep wearing your mask, keep washing your hands, keep avoiding large gatherings. Thanks. And now, Governor Brown, I'll turn it back to you.
Thank you, Director Allen. And with that, I'm going to turn it over to our Adjutant General, Mike Stencil. General Stencil, take it away.
If you can unmute it off your computer again, sir. Tried cycling a couple times. How do you hear me now? All right, thank you. Hello, everyone. Earlier this week, the Oregon National Guard, at the direction of the governor and Oregon Health Authority, was able to offer up our Dalles Readiness Center to the Wasco County for vaccine distribution, as well as utilization as a vaccine clinic. At the same time, we were able to mobilize 64 soldiers and airmen in support of Salem Healthcare down here in Salem over at the fairgrounds and their mass vaccination facility. So our understanding that effort has allowed them to pretty much double their capacity and throughput there, currently looking at around 2,000 vaccinations going through that facility today. We're also working with the OHA and developing plans for long-term health support for other counties here around the state. Part of that includes potential mobile capability, as well as other large mass fixed site distributions as those are developed. With that, I'm going to go ahead and hand it over to Trent Green, the COO for Legacy Health.
Thank you, General Stencil. Good afternoon. My name is Trent Green. I'm the Chief Operating Officer at Legacy Health. The health systems in Oregon have been at the forefront of responding to this pandemic since last March. And for the last 4 weeks, we've made great progress moving as quickly as possible to vaccinate thousands of our frontline healthcare workers, including doctors, nurses, and individuals who work inside of our hospitals, delivering care to our patients. But we know we need to do more to ensure Oregonians are vaccinated as quickly as possible. I think I can say confidently on behalf of my hospital and health system colleagues across the state that we're committed to ensuring Oregonians receive the vaccine safely, quickly, and equitably. Here in the metro area, Legacy Health is proud to join with other healthcare leaders, including Kaiser, OHSU, and Providence, to jointly stand up a large-scale vaccination site at the Oregon Convention Center beginning next Wednesday, January 20th. As we've been doing this as independent organizations over the last month, we've realized that scale is important. And our current independent efforts will not ramp up fast enough to ensure that every Oregonian receives a vaccine in a timely manner. This morning, 77 individuals from across our 4 organizations met in a combined in-person virtual format at the convention center and began outlining plans for how we can safely and effectively deliver vaccines to up to 25,000 Oregonians a day. Based on what we now know, we're going to start with a model that administers 5,000 vaccines a day with a plan to scale to 10, 15, 20, or even 25,000 to the degree that the federal government and the state of Oregon can deliver vaccines. We are eager to partner with the Oregon National Guard on vaccine distribution strategy. It might seem to some that hospitals are not moving fast enough, but as has been mentioned, this vaccine effort is unlike any vaccine administration process we have ever implemented. It's not as simple as duplicating our yearly influenza vaccine campaigns. The COVID-19 vaccine requires special storage, handling, documentation, and monitoring of individuals for 15 to 30 minutes after the vaccine is administered. All the while, we're adhering to appropriate physical distancing requirements. Now, there are still a lot of details to sort out, but on behalf of my hospital and health system colleagues, we ask your patience as we stand up our mass vaccination clinics for our communities across the state. Our aim is to move quickly, but we do not want to repeat what we have seen across the country, where we have seniors waiting in long lines for hours to get vaccinated. When Oregon first administered the COVID-19 vaccines on December 16th, it brought renewed hope to our teams at Legacy Health, and I know to other healthcare providers across the state. There does appear to be a path to getting our kids back in the classroom, giving grandparents the ability to once again hug their grandchildren, and for all of us to gather safely with family and friends. Thank you, Governor Brown, for the opportunity to share how the healthcare community is again rising to the challenge.
Thank you, Trent, and please thank your partners, obviously Legacy Health, Oregon Health Sciences University, Kaiser, and Providence for all of their collaborative, collective efforts to swiftly and safely vaccinate as many Oregonians as possible. And with that, Charles, we're ready for questions.
Thank you, Governor. For our reporters on the line, please use the raise your hand function to get in line to ask a question. We'll start with Lisa Balick from COIN. Go ahead, Lisa.
Yes, thank you. Governor, first question. It seems like we're back where we were before, putting seniors, especially as you just mentioned in the news conference, that they're 30% of the death rate over 80 behind the teachers once again. Why?
Thank you, Lisa, for the question. I am absolutely committed to vaccinating Oregonians as quickly and as safely as possible. I made the decision to prioritize our educator personnel because I'm absolutely committed to getting our children, our students, back into the classroom as quickly as possible. Our children are really struggling of all different ages with comprehensive distance learning. It's a relatively small population, as Director Allen mentioned, roughly 100,000 folks that we can vaccinate in a period of 2 weeks. And I'm absolutely committed then to moving to our senior population as well. Our seniors, we know, are very vulnerable to the disease. And if we had more vaccines from the federal government, we would be vaccinating all of these folks. But unfortunately, we don't have that level of vaccines. We're going to have to do them in order based on age category. And again, with all of our partners in the healthcare community. We're incredibly grateful to our partners that are stepping up to help us with this collective effort. Director Allen, do you want to add any other details?
Yeah, just that it's worth pointing out that we had expected and had talked about getting to educators sometime in the second half of February. And so, for all of our initial rollout challenges, we're actually well ahead of that pace by being able to open up to that population the last week of January. And so it means that we'll get to people over 65 and all of our other populations that much sooner.
Thank you, Lisa. We'll go next to Erin Ross with OPB. Go ahead, Erin.
Hi, Governor Brown. I am curious as to why we are hinging the reopening of schools specifically on the administration of vaccines to teachers when we know that children can get and transmit this virus, even if they don't seem to do it at quite the same level. What happened to worrying about the metrics that we're seeing or worrying about the amount of virus circulating in a county? Why aren't we using that as part of our decision process anymore?
It absolutely is. On January 1st, the metrics became advisory, and our Department of Education is working and will be releasing updated information on Tuesday, January 19th. But for school districts across the state, Those districts can now make those decisions based on what's happening in their communities and based on conversations that they are having with teachers, with parents, and with staff. We know that in-person learning can happen safely with the appropriate protocol. And that's why Oregon has a very extensive safety protocol guidelines. It's roughly 90 pages, our Ready Schools Safe Learners, that we are encouraging schools to follow. But it is critically important that we work hard to get our students back into the classroom, because children of all ages, but particularly our little ones, are really struggling with comprehensive distance learning. You can imagine that it's hard to learn over the internet, to learn how to read and learn how to write and learn how to do math. But I also know I have a number of seniors, high school seniors, on my Ready Safe Schools Reopening Council. And they talked to me, they shared with the council the challenges that their classmates are facing with distance learning. So we are working to do this as quickly and as safely as possible. My goal is to get our youngest ones back into the classroom around February 15th, and hopefully we'll be able to get the older ones as well shortly after that. Director Allen, did you want to add anything?
No, Governor.
With cases rising, is it safe to reopen schools?
That's a really good question. There's no doubt that cases are rising right now. It's not unexpected with the Christmas holidays and the New Year's Eve holiday. We expected to see a bit of a surge. It's happened after every single holiday through the last year. But the good news is that Oregonians have worked really, really hard to adhere to our safety guidelines, whether it's mask wearing, washing hands, watching distances, and obviously severely limiting their social gatherings. And so we're watching the numbers very closely. And I will just say, many school districts across the world have figured out how to get their students back into the classroom as safely as possible. I'm confident with the assistance of vaccines, with additional resources. As you're well aware, Congress allocated an additional pot of money for our K through 12 schools. For Oregon, that looks like $500 million. And the work we're doing on the ground to ensure that school districts have rapid testing capacity, I'm confident we can do this safely.
Thank you.
Thanks, Erin. We'll go next to Pat Duras with KGW. Go ahead, Pat.
Thank you. So a couple of questions. One, but for the governor and Pat Allen, is there a guarantee of ongoing flow of the vaccines? I mean, outside of this surge, do we feel comfortable that they're still going to keep coming in? Also, I was a little confused on the second doses. I think, Director Allen, you said the state's expecting 154,000 doses next week. And then maybe there's an additional 70,000 that are coming in that are reserved for second doses. And then finally, just the dates for the seniors. I understand February 8th is the target for 80 plus. And then does it just go back 1 week for each one? Would it be a week later for 75 and then a week later for 70s? Or can you clarify that, please? Thank you.
So Pat, you asked a number of questions there. I'm going to turn it over to Director Allen, and hopefully between the two of us, we can pick them all up.
And hopefully remember all of them. So to the first question, are we assured or guaranteed of supply? No. I certainly, other than this issue with Secretary Azar's statement on Tuesday, I'm generally confident in the ability of Operation Warp Speed to deliver vaccine to us at the schedule that they give us and lead us to expect. Other than some initial fits and starts, they've been able to do that. It's an entirely different atmosphere than it was earlier in the pandemic when we were struggling with personal protective equipment or testing supplies or those sorts of things. There are no guarantees, but this process seems to be working relatively well. In terms of the dose count, The 154,000 doses does include 72,000 Moderna booster doses, which would expect to be administered over the next 3 or 4 weeks, following a similar pattern to how the ramp up went. But it also includes a supply of Pfizer first doses, Pfizer boosters that are further along, and first doses for Moderna. But it just explains the notion that when it looks like there's a, quote unquote, a dose sitting on a shelf, it may be sitting on a shelf because there's someone's name attached to it, and they're not going to be ready for that dose for 2 weeks or 3 weeks. And so we need to manage to that. And I did manage, Pat, to forget the third part of your question.
I think Director Allen, I can pick that up.
Yep.
The week of January 25th, we're going to start with educators and staff and school personnel, including, of course, bus drivers that help us get kids to and from school. And the week of February 8th, we will start with seniors over the age of 80, and then it will drop down to 75 years old the next week, 70-year-olds the next week, and 65-year-olds the next week.
And let me add just a quick little bit of detail to that, if I could. At the current rate that we're receiving vaccine, we expect it would take about 12 weeks to get through the population of everybody 65 years and older. As Trent Green indicated, that's based on supply, not on the ability to drive throughput. If we get more supply, we've got the ability to provide more shots. And so if that supply goes up, we could get through that population faster. But it's over 700,000 people who are 65 and older. There's overlap with other populations like long-term care, people in the workforce still, those kinds of things. But that's our estimate.
Okay, thank you.
Thank you, Pat. We'll go next to Amy Green with the Oregonian. Go ahead, Amy.
Yes, first before I ask my question, I want to make sure I heard Director Allen correctly. Did you say that 30% of the deaths in Oregon are people 80 and older?
Yes, that's correct.
Okay. I'm wondering if you're understanding how many elderly people are actually dying of COVID in Oregon. According to OHA's website, it was 917 deaths. So far of people 80 and older, that's 53% of deaths. If we look at 60, 70, and 80-year-olds and above, they account for 91% of deaths. So I'm wondering, they're 25% of the population and they're 91% of the deaths. Could you speak more about balancing that, prioritizing saving lives over having school children in online schooling for a couple more weeks? By my calculation, if people 80 and older are 53% of deaths, delaying their vaccinations by 2 weeks equals 178 more Oregonians who are dead, who are 80 and older, because we waited 2 weeks. Can you speak to that, you and the governor?
Sure. I mean, I think what that fails to recognize is the extensive efforts that are happening right now in a partnership with 3 pharmacies and our long-term care facilities to vaccinate every senior living in a memory unit, in skilled nursing, in assisted living, and independent living. That group of people roughly is about 70,000 folks. That includes staff as well. And as you know, we've got a very concerted effort directed by the federal government to make that happen. I can't speak in further details to the numbers. I don't know if Director Allen can.
Yeah, the only thing I would add about the numbers is that half of those deaths, I mean, that you're referring to, do occur in long-term care, and that's why prioritizing both the A and B part of that program ahead of everything else was so important to be able to do, because those age bands and people in long-term care obviously overlap significantly, and so that's been the approach to try to do that mitigation and balancing.
Governor Brown.
Just one follow-up.
Sure.
Long-term care accounts.
I'm gonna. Sorry, from Legacy Health. Sorry.
No worries. Thanks, Governor Brown. I did want to comment. Look, I don't want to take any statement or stance on who gets the vaccine in what order. That's not my job. We are only coming together to be vessels by which the vaccine is administered into Oregonians as quickly as possible. I do want to comment, though, from an operational standpoint, we actually stand in support of the prioritization here with teachers. It's an organized group. We actually think. We met with the metro area chief operating officers, met with a number of school superintendents the other day. We believe, this is an audacious goal, if we had the supply, that we could vaccinate all teachers, coaches, janitorial staff, bus drivers, et cetera, in the metro area in a single weekend. 25,000 on a Saturday and 25,000 on a Sunday. It's an organized group. The Portland public schools know who their teachers are. Riverdale School District knows who their teachers are. St. Mary's Academy knows who their teachers are. It's organized. We could be planful, and it would actually allow us to much more rapidly get to those populations that will be a little bit more difficult for us to communicate with, to schedule, and so on. So I just want to comment on the operational aspects. Again, I'm not taking any stance. We'll do whatever people want us to do in terms of the prioritization. Our job is to be the administrators of the vaccine, but I do think there is a lot of logic here in the operational aspects and actually executing well from an operational standpoint.
Thank you.
Just my follow-up to your governor, your answer. If half of the people, let's just say it's half of the people are in long-term care facilities who are dying, and 24 people a day are dying from COVID. So that's 12 people a day who aren't in long-term care facilities, who don't have the chance to get vaccinated yet, who are dying. And if 91% of them are 60 and older, that's like 10 people a day dying who are elderly, who are not in long-term care facilities. That's still quite a number that, that's over the course of 2 weeks, 140 people.
Look, as we said, we are working as hard as we can, as efficiently as we can, and as safely as we can to vaccinate our most vulnerable Oregonians. Oregon has done, from a national perspective, a remarkable job of protecting our seniors. I was one of the first governors in the entire country to restrict access to nursing homes. We have worked really hard to protect and care for our seniors. I'm absolutely committed to getting this population vaccinated as quickly as we can. And I'm honestly looking forward to a federal partner that is competent and interested in a comprehensive national approach to vaccines and to a vaccination strategy. I've had several conversations in the last 2 weeks with the Biden-Harris administration. They're committed to providing states with the resources and support we need to be as successful as we can at this effort. They understand the seriousness of the pandemic and the efforts, the Herculean efforts that our partners in the healthcare systems have had to make, both in terms of caring for vulnerable Oregonians, saving lives, and now and testing, and now turning to vaccination efforts. So I do think that by having a competent federal partner, that will assist us in moving our efforts along quite readily.
Thank you, Amy. We're going to go next to Gary Warner with EO Media. Go ahead, Gary.
Yes. Do you know any other states that are using the same priority of putting teachers above older folks?
Gary, I know that all of the states are doing things a little bit differently. And the good news is I've had numerous conversations with my fellow governors on the West Coast, particularly Governor Inslee. We are all working to do this as quickly and as rapidly as we can, and we are all looking forward to a new federal partner.
Is that a no?
I'm just unaware. I'm sorry, I don't have any details on that.
Why would you be unaware if this is such a big decision?
Gary,
life and death.
I know that states are doing things differently. I had a conversation with Governor Inslee this week. They are vaccinating people 70 and older. I cannot remember, honestly, whether they are including teachers in that vaccination strategy. I am aware, obviously, that Colorado went in and vaccinated 70-year-old and older in the 1A population. We are all making different decisions. We are all doing the best job we can with the information and the tools and resources that we've been given by the federal government.
Thank you.
Thanks, Gary. We'll go next to Gillian Flackus with the AP. Go ahead, Gillian.
Yes. Hi, Governor Brown. Can you hear me all right?
Yes, we can hear you.
Okay, great. I'm just wondering how much of your decision to vaccinate teachers ahead of the oldest senior citizens in Oregon has to do with pushback from the teachers union. I know that in Lake Oswego School District, teachers were very upset when they found out they would have to return on February 4th. And I know that that's obviously probably some feedback that you're hearing. And I wonder how much that has to do with your decision.
Actually, I made the decision based on the fact that we have got to get our children back in school. I know of families where 12 and 13-year-olds are attempting suicide. I talked with the CEO and president of Salem Health on my vaccination tour this week. She is hearing of many 11 and 12-year-olds attempting suicide. We know that our schools are a place of social interaction. They're a place where young people, students can get their behavioral health and emotional supports met. And they're also a place where our kids can get educated and our students are struggling. And I made the decision based on the information, based on my conversations talking with Dr. Seidlinger and others at the Oregon Health Authority, that this was the safest way for us to get our children back into the classroom.
We'll go next to Brenna Kelly with KPTV. Go ahead, Brenna.
Thanks for taking my question. What does the loss of the Federal Reserve of doses mean for people who've received their first dose already? Just hoping you can clarify that. Will anybody lose their booster dose because of this? And if so, how long is that window to get the vaccine before maybe they have to start over? What happens there?
I'm going to turn that over to Director Allen.
Great, thanks, Governor. Yes, it does not affect the ability of people to get a second dose. What we had anticipated being able to do with that reserve was speed up this process so that we could do, in fact, educators and seniors start them at the same time. So it takes away our ability to do that. We continue to receive first and second doses. I've already talked about the Moderna doses that we're receiving next week, and we will continue to manage that supply so that while we make adjustments based on stocks on hand and those kinds of things, that we protect those second doses so that people are able to get them at the time the FDA schedule recommends.
So protecting those booster doses is always a priority. No one should be losing out on that.
That's correct.
Thank you.
Thanks, Brenna. We'll go next to Bryce Dole from the East Oregonian. Go ahead, Bryce.
Hi, can you hear me?
We can
Yes,
hear
go
you,
ahead.
Bryce.
Great. So I spoke with multiple officials here in Umatilla County who said that they were hearing from state health officials that in order to speed up immunizations, there was a possibility that vaccine shipments and efforts would be prioritized mostly to centrally populated areas, such as in cities in Western Oregon, along I-5. Like, can you confirm if or if not this is a strategy that the state is considering? And if so, like, what's the reasoning behind that? What would it look like? And what's your response to those who are in less populated and rural areas who are concerned that vaccines just won't get to them as the supply is already dwindling where they live?
Director Allen, would you like to respond to that, please?
Yeah, thank you. What I said is we are prioritizing high throughput locations that can do lots of vaccinations, but you can do high throughput locations in a variety of settings. And you don't need to do them at the exclusion of lower throughput settings. If you look at our vaccination dashboard and look at the counties in Oregon that have got the highest rate of vaccination, that's Harney County, Wheeler County, Jefferson County, Sherman County, Wasco County. We are getting vaccine out and distributed into rural parts of the state. What I did say to a variety of people, including folks from Umatilla County yesterday, is nobody anywhere in the state is going to be happy with their allocation. everybody everywhere in the state is going to be accurately believing they can administer more vaccinations than they will have supply for, and that is going to continue for many, many weeks, if not months. We just need more vaccine, and that's the simple long and short of it.
Thanks, Bryce. We have time for just 2 more questions, so we'll go next to Rachel Monahan with Willamette Week. Go ahead, Rachel.
Hi. As has already been clear in this press conference, there was some kind of math error on your part. So I'm wondering, particularly Director Allen, if you could lay out what commitments Oregonians or Oregon had from the federal government. Was there anything on paper that committed to these doses, and how many would be released? And further, what plans the state had in place to distribute these vaccines that have now been put on hold? Because it seems like the plan has been completely changed up now that you have more time to roll out something slower.
So Rachel, I cannot speak to specific numbers. What I can speak to is I was on a call with the White House on Tuesday. Secretary Azar committed to releasing all reserve vaccines that were on the shelf in the refrigerators. I took notes to that effect, obviously, and I have his statement that we can certainly share with you. But on Tuesday,
I'm interested in how you figured out the number that was the basis for you deciding to expand the number of Oregonians who are eligible for the vaccine, and where that number came from.
Thank you. Director Allen, do you want to talk about
Yeah, I
calculations?
can tackle that. First, in terms of math error, I think you may be referring to the 30% that was on Amy Green's question. That's my fault. I read that as 30% of deaths. It's actually 30% of hospitalizations for over 80. Apologize for that. When Secretary Azar made his announcement, we did not have a lot to go on and had to make our own estimate of what we thought that statement meant in terms of what was available. We looked at some statements that had previously been made about sizes of reserve that were out there. We looked at how much we expect to receive in first and second doses across the 2 vaccines, and came up with that assessment of, I think the numbers I read were between 135,000 and 220,000 doses, something on that order. It also kind of passed a little bit of a logical test of, if it's going to be a lot smaller than that, why would you go to the trouble of making a big announcement about releasing those results? But those were our estimates based on the best information we had at hand. Remember too, this was an announcement that was completely unexpected on a Tuesday, and Thursday is when we would need to make allocation decisions about those doses that we thought were coming. So we didn't have a whole lot of time to try to pin that number down.
That answered half the question. That answered half the question. What distribution plans did you have in place?
Oh, sorry, I talked about those in my comments. Our plan was to begin on the 23rd, opening to both education workers and seniors. We would likely have implemented the same kind of a tiered approach, because that age 65 and over is a larger population than everybody else we have prioritized for vaccination so far. And would have used some of the same tools that you've heard about today in terms of the site that Trent Green talked about, a Salem site, those kinds of things, as ways to begin to ramp that up.
Thanks, Rachel. We have time for just 1 more question, so we'll go next to Genevieve Riom with K2. Go ahead, Genevieve.
Thanks, Charles. I appreciate that. Now, I'd like to comment on the Federal Reserve doses that we've all been talking about for the past hour. But, well, the news of the Federal Reserve doses being taken away is certainly disappointing. Does the state absolutely need those doses right now? As of Wednesday, the state have received a total of 321,000 vaccine doses, and we'd only administered 146,000. Why is the state so dependent on this Federal Reserve when at this point we're using less than 50% of what we have on hand?
Director Allen,
Yeah,
I'm going to
thanks.
turn that over to you.
Thanks. So the most recent numbers are that we have now administered 173,000 or so of those doses. We're up over 53%. There are several factors that are at play here. First, the CDC counts doses when they have been shipped to us, not when they've been received here. That's a small piece of the discrepancy. Second, we've talked about data errors that are either lack of reporting or lack of successful transfer of data. We've been working steadily with our vaccinating partners to clear that up and making good progress, but there are still doses out there that are unreported. Vaccinators have 3 days to report numbers, and the first day's report usually ends up being anywhere from 30 to 50% higher by 3 or 4 days later, and so there is a lag there. Further, you've got doses that we receive, or that we receive in Oregon at a hospital or a local public health or something like that. And as we've talked about, those doses are for people scheduled for days over the coming week for booster doses. They're scheduled for events and clinics. Salem Health will receive doses or has received doses to use over the course of a week in its clinic. And so we don't think it's accurate to say that there are 150,000 doses sitting on a shelf. There are 150,000 doses that we can't report having been administered yet, but they're allocated for people to get shots. They're in position to be able to be administered, or they have been administered and haven't been reported yet.
So if 150,000 isn't an accurate estimate, then what is an accurate estimate as to how many doses are sitting on shelves?
We think there are very few doses sitting on shelves that don't have a plan for that dose and a plan that can be executed in the next week. That's the biggest change we made in our allocation process, was to do a call down of all of our vaccinating partners to talk about the allocation they had, the supplies that they think they have on hand, and what the plans are to be able to get those doses out. And that's why I think you've seen the numbers of vaccinations done over the past week increase so significantly.
Okay, and I just have one more quick question for a colleague, but what is the protocol to make sure that vaccines are not wasted or that they don't expire? We've heard reports of hospital workers calling family to get the vaccine so they don't go to waste. I mean, is that happening, and what's the plan to make sure none go to waste?
This is one I might ask for some help from Trent Green on, but I would say broadly, at a very large scale, we are not concerned of and are not aware of large scale loss of vaccine. If kept in ultra cold storage, for Pfizer or the 0 Fahrenheit for the Moderna vaccine, that vaccine will keep for 6 months. It'll keep for 30 days in its next storage mode, which varies for the two vaccines. What has occasionally happened that we're aware of is a tray of vaccine will be opened. There are extra doses being harvested out of those vials. It's unpredictable how many extra doses can be gotten. And then you'll have human variables of someone didn't show up for an appointment or something like that. And so you've got these open vaccines that now have a lifespan of hours, not days or weeks or months, and you need to use them. Systems have done a really great job of basically at that point finding almost anybody to vaccinate, because we don't want to lose that dose. But sometimes they do lose the dose. An oddity of the federal vaccine reporting system is if doses that are lost are part of the extra doses in the Pfizer vaccine, that doesn't count as waste because they were extra to begin with. That's weird. I completely agree. That's the way the federal system definitions work. But that's also rare. What we're really trying to do is make sure once those vaccines are open, they're being used. Trent, do you want to comment at all on this?
Yeah, Director Allen, just a couple of comments. First, there's a big difference between observed and expected. And so I can tell you our experience at Legacy, we have administered well over 1,000 more doses than we had originally been expected to, based on what Director Allen just indicated. We're consistently getting 6 to 7 doses out of Pfizer and 11 out of Moderna. One of the things that has been a challenge is we realize either through no-shows, we're doing all of our appointments in a scheduled fashion, either through no-shows or through the increased doses in our vials, we'll find at the end of a vaccine clinic that we might have 15 to 20. In the early days, that was pretty easy. We could run around the hospital and find somebody who hadn't been vaccinated. We're now finding the more people we have vaccinated in our facilities, that is increasingly difficult. So it gives us a chance to implement some of our operational improvement efforts. So we are now both overscheduling and underproducing from a pharmacy standpoint, so that we do a better job of matching the demand in the clinic that day to the actual supply that is ready. All of those efforts will only be further enhanced as we begin to move to these mass vaccination strategies across the state, so we can much more effectively utilize and leverage the vaccine.
And Trent, while I have you said the goal is to reach 25,000 vaccine doses a day. When do you estimate that will happen?
It's all dependent
thanks,
on.
Genevieve. Just to know, we'll just have to wrap after this question. Thank you.
We're prepared to scale as quickly as we get a sense that the federal government and the Oregon Health Authority and our partners with the National Guard can deliver us the supply to do it. So as I mentioned, we met today, 77 individuals in a very collaborative fashion, outlining plans, looking at the space, designing the space. So we are ready to go from what will be in the beginning, 5,000 to ramp as quickly as that supply of vaccine is available.
Want to say thank you in closing to Trent Green, the Chief Operations Officer at Legacy Health, Director Pat Allen of the Oregon Health Authority, and our Adjutant General Mike Stencil. Please stay safe out